As we continue our journey through the history of vitamins and their uses, we come to Dr. Joseph Goldberger. He was trained in Hungary, but he emigrated to the United States and became an epidemiologist. That is, someone who searches out the roots of disease. And back in 1914, the Surgeon General of the US asked Goldberger to take a look to see what was causing this terrible disease called pellagra, which was affecting a lot of people, mostly in the southern states. And these were people, of course, who did not have a very varied diet. The disease was most common among cotton pickers. And it was at first believed that it maybe was something in cottonseed oil that caused this. And there were all kinds of nonsensical cures that were offered at the time as well, ranging from strychnine to various kinds of baths. Pellagra is indeed a terrible disease. It is known as the disease of the 4 Ds, for dermatitis, diarrhea, dementia, and unfortunately, often resulting in death. Well, Goldberger carried out some very interesting experiments. And he asked prisoners if they were willing to volunteer for his experiments. And many of them, of course, were willing to volunteer because there was a pot of gold at the end of that rainbow for them. Their sentence would be reduced if they took part in these experiments. So Goldberger decided to play a little game with them and give some of them diets that were identical to the ones that the cotton pickers were used to, which was basically a corn-based diet with very little meat, very little dairy products. And he was able to show that they went on to develop pellagra. He also carried out another very interesting experiment. He organized what were called filth parties. And in these filth parties, he injected volunteers, and he was one of them, as was his wife, with blood from patients who suffered from pellagra to see whether or not this was a communicable disease. Well, it turned out that it wasn't. He was not able to transmit pellagra. So it was pretty clear that once again, there was a dietary connection and that there was something in a balanced diet that would prevent people from getting pellagra. The question was, what was this preventative factor? What was there in food that was missing in the diet of the cotton pickers that was present in other diets where people were not getting pellagra? Well, that little mystery was eventually solved by Dr. Konrad Elverum. And he isolated a specific substance, a compound, from food, which we now know as niacin or vitamin B3, or nicotinic acid. And this was the pellagra preventative factor. Now, interestingly enough, even if it is not present in food, it can in the body be made from tryptophan. Tryptophan is an amino acid. And anyone who's consuming sufficient amount of protein will not be deficient in niacin because some of the amino acid tryptophan will be converted to niacin. However, in those populations where pellagra was rampant, of course, they weren't eating protein either. So the fact that protein can give rise to niacin really was of no consequence. Today, we know of another interesting connection of niacin, and that is in reducing cholesterol. High blood levels of cholesterol constitute a risk factor for heart disease. And of course, there are various attempts to lower the LDL, the so-called bad cholesterol. And there are drugs, of course, that do that very well. The statin drugs certainly are excellent at doing that, but so does niacin. And niacin has an advantage in the sense that it also raises the HDL, the so-called good cholesterol, and more than the statins do that, and it lowers blood fats called triglycerides. And these are also linked to increased risk of heart disease. The only problem with using niacin to try to control blood cholesterol is that it has a side effect. It has to be used in very high doses. And at those doses, it causes facial flushing. It causes the skin to become very, very noticeably red, and also kind of feeling of pins and needles. If people keep taking niacin, it generally tends to disappear. This has no real consequence, and it's annoying, which is the reason that many people give up niacin. But those who stick with it can actually control their cholesterol, although statins certainly seem to be a more popular way to go. There are a number of other B vitamins, and a great deal is actually known about these. Of course, there are categorizations, and you can look in textbooks or you can look on this chart and see where these are found and the various conditions that result from deficiency of these substances in the diet. But one unifying factor in these B vitamins is their mechanism of action. They are what we call coenzymes. Enzymes are biological catalysts. They're proteins that are made in the body that enhance all of the chemical reactions that together constitute life. But for these enzymes to work properly, they have to collude with the B vitamins. That's why they are called covitamins or cofactors. And the different B vitamins will react with different enzymes, and they take part in many, many processes. They are certainly involved in energy production. Energy production, of course, in the body comes from converting the food that we eat into carbon dioxide and water, which we exhale, and at the same time, we produce energy. And the reactions, there are many, many reactions, of course, in the body that are involved in metabolizing food. And these involve the B vitamins. And that, of course, means that the B vitamins are indeed involved in energy production, but they are not pep pills. Often advertisers will make hay with the fact that B vitamins are involved in the body's energy-producing processes, and they claim for various products that the B vitamins do the same thing. But if you look at something like Red Bull, which of course they have loaded up with B vitamins in order to try to make this energy claim, the jitteriness or the energy that you get there is from the caffeine. Red Bull is not the only one. If you take a look at some other medications out there, Airborne, which professes to be a remedy for the common cold, and again, they claim that it gives you energy because of the B vitamin content. And you can even buy Super B Energy Complex vitamins. And again, of course, the insinuation is that this will rev you up and give you energy. That's not the case. It certainly is true that people will lack energy if they are deficient in B vitamins. But taking extra B vitamins is not going to give any more energy. That's just not how the way things work. To look at one more specifically, vitamin B6. Yes, if there is a deficiency in vitamin B6, you will feel weak, you will feel sleepy, and there will be some neuropathy, feeling of tingling in the extremities, and sometimes even personality changes. The classic sign of vitamin B6 deficiency, though, is a dermatitis, that is, skin outbreaks, and the tongue becomes sore and red and smooth. Those are vitamin B6 deficiencies, but of course, these symptoms or these signs are associated with many, many other conditions as well. So yes, if someone is really deficient in B6 because of an awful diet, which would be most unusual in North America, then giving vitamin B6 supplements will solve the problem. However, there's a bit of a warning here because we've known since the 1980s that very high doses of vitamin B6 will in fact cause some neuropathies. Is there a need to take vitamin B6? Probably not, because it is so widely available along with the other B vitamins in food. There is, however, one that we have to note where supplementation may in fact be appropriate.